Welcome back to the program. If you or your children looking for a good, solid orthodontist that can make magic on your face, really change the entire appearance of your face with his work, this is the man you want to know. His name's Dr. David Sarver. He's an orthodontist right here in Birmingham, although his work has appeared on The View, on the Today Show. So you're nationally known. You speak all over the country for your work. Welcome to the show.
Nice to be here.
You know, you work on so many people, not just adults, children, both different groups. Yep. What got you into this to begin with?
Oh, I think like a lot of orthodontists, my experience as a child, I really enjoyed my experience. My orthodontist saw me at a time of my life, adolescence, yeah, and treated me for a problem into mid-adolescence. In other words, helps me grow up, yeah, and contributed to that, and I valued that very much.
Well, we're going to look at some pictures right now. For you at home, you're looking at a picture of a gentleman that Dr. Sarver worked on. Now, you're looking at a tight shot right now of his teeth from the front, and then you're going to be seeing a side view. A really big, would it be an overbite, underbite? What is that?
We would call that an underbite, and it's there are certain bite patterns can be dental or skeletal, and his happened to be his growth pattern. I knew Jonathan when he was a young Cub Scout in my son's Cub Scout troop. Timing of treatment is important. There's some things that are treated very well in the adolescent, but there's some things that are so severe that it's better to wait and treat it with a combination of orthodontics and orthognathic surgery, which is an oral and maxillofacial surgeon. So in Jonathan's case, I waited until he was 20 or 21 years old. The main thing being waiting until he is completely finished growing in his type of case. So we had to monitor him until it was time.
And so you were able to judge that, and that's the difference that sets you apart from so many orthodontists out there, because it's not just about getting them in there and getting them done. It's really judging the whole face, their growing patterns, and how you can help them long term.
Yeah, as we said earlier, it's not so much about the treatment, it's the outcome.
Yeah.
In other words, it's not a procedure. It's taking a child, analyzing what your problems are, what's the best time to treat them, and treating at the right time.
Okay, and now you're getting ready to see some pictures, essentially of a before and after. Now, the first shots you're going to see of your patient when you first started treating him, and then the after, he looks like a completely different person to me. I mean, in a good way.
The beauty of his case is that I combined not only what we do orthodontically, but the talents of an oral maxillofacial surgeon and a facial plastic surgeon. Yeah. So Jonathan had really a rather complicated procedure where we took both jaws, moved the upper jaw forward and down in the front so that he would see more teeth when he smiled, lower jaw. And then, because moving his upper jaw forward as far as we were going to move it would widen his upper face and his nose, we had the facial plastic surgeon at the same time perform a rhinoplasty to idealize the aesthetics of the midface, because after all, he's going to be asleep and you would want to maximize the result, yeah, at that time.
Well, and it's interesting because, you know, smile's your first impression, whether you're on a job interview or in school, and you can really help so many kids out there that are teased because of their smile or because they maybe have a jet jaw, an underbite, an overbite. You can help them and get past that and look like they want to look.
Well, which is the reason that I became an orthodontist, was that same experience of going from here to there. And in Jonathan's case, he just had to wait longer than most. Yeah. But the reward was certainly there.
Okay, if people want to get in contact with you in closing, how do they do so? Website, phone number?
Our phone number or our website, and I think you'll list that.
Okay, sarverortho.com is the website. Right. The number is on your screen, so you can give him a call, schedule an appointment, whether it be for your child or for yourself, because you do both. And you can help people out and have a beautiful smile, and it certainly is a difference. So congratulations on your groundbreaking work.
Thank you.
Thank you as well. Dr. David Sarver, Sarver Orthodontics. We'll be right back.
We've got a really special treat for you guys today. He's a well-known orthodontist, and his works appeared on The View and even on the Today Show. He's based right here in Alabama.
That's right. We've got Dr. David Sarver. He can give your entire face a makeover, change the look of your face. You don't have to have a plastic surgeon. You can do it with orthodontics. Welcome to the show.
Nice to be here. Thank you.
So when people come to you, I'm assuming they've either got a bite that they want changed or they're having some TMJ issues. What's the primary thing you see, and how do you get these results so quickly?
Well, you know, most patients are brought as adolescents by their parents because they see something that they don't like, and the dentist has seen more of the functional issues and make a referral. But it's a little bit of mix of parental awareness that, geez, something isn't right. I want to get that checked out.
I want to get our viewers right to some pictures. You've got a female patient of yours, and this is a woman that you've worked on. Look at the difference. It says Susan through the years, the left part of your screen, from where she started to where she is now. Huge difference in her jawline, her entire face.
What this represents really is 25 years of photographs that Hillary was referred by her pediatric dentist at age 11 and a half. And she represents really a pretty good choice to show, because by the rules of the day, and all of medicine and dentistry all have rules and standards that we go by, but sometimes the doctor has to step outside a little bit and push things a little bit. And so in her case, you know, when she smiles, you see, anybody can see that she had crooked teeth. The next picture would show on her resting relationships that she doesn't have a lot of lip projection. These are things that we're used to looking at and you're not. And then the next picture shows finished. And what we did was we used forms of expansion of her teeth and advancement of her incisors, which, you know, we not really doing plastic surgery. What we're doing is sort of the reverse, that we are providing more hard tissue support of the teeth, of the lips, by bringing the teeth forward. So you see that Hillary's lips are now fuller, which is what in the adult most of us would like, to have that youthful sort of appearance.
Dr. Sarver, let me ask you, how long was she under orthodontic care, and is this working so well because you started at a young age? Oh,
well, you hit the nail on the head there. The appropriateness is the timing of referral by the pediatric dentist. The dentist recognized the problem at age 11 and sent the kid on for treatment at that time.
Well, you've got some pictures of her at 26, right? At 26 years after.
Right. And the idea is to have a vision for where she's going to be 25 years from now, so that her treatment took 2.5 years. As far as she knows, she wore braces.
And that was it, right?
That was it. To her, it was like braces. It wasn't plastic surgery. It wasn't anything.
Beautiful smile now.
Right, and profile and lip support. And so it's all, now the trend in orthodontics is to think this way about the face and how we want a patient to look. Appearance-wise, smile, and what we term enhancement of quality of life. It's more than just getting the teeth to fit. It's about what's going to make her face and appearance enhance her life for the rest of her lifetime.
We've got some video too. It's kind of like a morphing video that you had sent over, and it shows her. Look at this video if you're watching at home.
Photographs from age 11 and a half all the way out to 25 years after her treatment.
So as the structure of her face changes as she gets older, you see your work orthodontically come into play.
Right. I have done nothing since the 2.5 years of braces. Right.
Under treatment. You know, and is this essentially a way where you're able to say to a parent, where surgery may have been necessary before, or another doctor may say we need to do surgery, look, there are some things we can do to really avoid that?
Yeah, pretty much. And the fact of the matter is that I never considered her as a surgical candidate. Had she come in as an adult and had never been treated, that would have been the surgical patient.
Dr. So catch it early. For people at home watching this, in closing, how do they get in contact with you? Can they call you to bring their child in, or maybe them as an adult? They need some work. How do they reach out to you?
Well, certainly they can call our office, or they can ask their dentist. And you know, and if they're not, you know, immediately in our area, they're welcome to contact us, and we're happy to give them referrals to doctors that would be helpful.
That's some information on your screen. All right. We thank you for your time.
Okay.
We appreciate it, and a whole lot more of the program still to come. We hope you'll stick around. We will be back in just a few minutes.